Welcome back. National Addiction Treatment Week takes place between October 19th to the 25th. According to the NYC Department of Health, overdose deaths in New York City remain at epidemic levels. In the first quarter of the year, 331 New Yorkers died from overdose. Sadly, the most deaths were here in the Bronx. During the pandemic, physicians continue to help reduce harm and treat opioid use disorder, helping people get medications they need with flexibility and telemedicine. Joining us now to discuss are two Montefiore doctors, Dr. Kristine Torres-Lockhart and Dr. Tiffany Lu. Welcome. Thank you so much for making the time to join us today.
Thank you for
Thanks
having
for
us.
having us.
Of course. So first, to start off, can you please help us define what opioid use disorder is?
Sure, I can do that. It's a great question. As you mentioned, the opioid crisis is sort of raging everywhere in the United States, including here in the Bronx. And so it's really common. And so I take care of patients who have opioid use disorder, both in the primary care setting and also in our methadone treatment programs here at Montefiore. And opioid use disorder really is a chronic medical illness, just like we think about hypertension or diabetes. And it's really characterized by changes in our brain chemistry that cause patients to really use substances despite having negative consequences from that drug use. So that can really mean having medical complications from their drug use, or maybe it's affecting their interpersonal relationships with their family and friends, or affecting their work life as well.
Thank you, Dr. Torres-Lockhart. And what treatments are available for opioid use disorder?
Sure. And so despite the fact that we are actually in an opioid crisis, we have some very effective medical treatments. And so one of the treatments is actually medication therapy. And the two most common ones that we use in our clinics, whether it's the 6 primary care clinics across Montefiore or our 5 methadone treatment programs, are methadone and buprenorphine. And so these medications have been really well studied for many, many years, and they've been shown to decrease overdoses, to really save lives, to decrease substance use, and also really decreases the risk of hepatitis C and HIV transmission for patients that use drugs. And so for methadone, this is a special medication that can only be provided in certain methadone clinics. And so, like I said, Montefiore has 5 of those across the Bronx where we see patients. And it's just a medication that's taken every day by mouth. In addition, buprenorphine, which is also commonly referred to by the trade name Suboxone. And that can be a medication that can be prescribed by any provider with a special license. And we have 6 different primary care clinics that also provide that medication. And again, it's just a medication taken by mouth and dissolved under the tongue. And so both of these medications are provided at our many different sites, and we actually take care of over 4,000 different Bronx residents who have opioid use disorder right now in our programs.
Wow. As we stated in the introduction, over 331 New Yorkers have died from overdose this year alone. And here in the Bronx, those rates are most of the rates are here in the Bronx. I wanted to ask, has opioid use and abuse increased during the pandemic? If so, is there an explanation medically for that?
That's a great question. And thank you for having me. So I'm a primary care-based addiction medicine specialist, and I oversee our buprenorphine treatment services in our primary care clinics. And with that, one of our missions has to really pay attention to overdose prevention effort, integration into a medical system. And so during the pandemic, what I saw in our services was that the opioid epidemic very much has been real and never went away. But in order to really help patients keep up with safer opioid use during the pandemic, we had to think about the fact that the pandemic was really causing people additional stressors, and that may be related to as a trigger for additional substance use. So now, if you can imagine, during the pandemic, we've had to isolate more at home. And so by being alone, some people may feel worsened mood and therefore more of a drive to use drugs. And for some of our Bronx-based patients who are not actually living in their own homes, maybe they're in congregate settings that may feel unsafe, and that actually lends itself to additional COVID transmission risk as well as overdose risk if they're more primed to use when they're with other people.
Thank you, Dr. Lu. Can you also tell us a little bit more about the surge in opioid deaths here in the Bronx? What are the demographics of these deaths here in our borough?
So what we know is that over the last 20 years in the Bronx, we've always seen a higher burden of drug-related overdose deaths compared to the rest of the New York City. And then the last decade, when national attention really turned to this being a major US crisis, we continue to see those numbers climb in the Bronx. And it's really a complex question that reflects the legacy of the war on drugs, the way that drug use is stigmatized and criminalized in our communities, but specifically in the Bronx, as other parts of the city, the major driver of recent overdose deaths related to opioids has to do with something called illicitly made fentanyl. So basically, that's not fentanyl that's prescribed by a medical provider to treat pain, but rather it's fentanyl that is made by the drug trade manufacturers. And why it's so attractive is that you only need a small bit of it, this white substance that can be cut into different street supplies to achieve a level of a euphoria, or as we say commonly, it's known as a high. So it's very potent and easy to disguise. So what this really means for the average person who may use drugs is that they may not be seeking out the fentanyl, but everything they use in their drug supply can be contaminated. Because fentanyl is a very potent opioid, it can really cause someone to suffer an overdose just without knowing that they're at risk. So this is actually a huge point that we use to educate patients as well as their loved ones, that you know, even before you realize you have a problem and is ready to get treatment for opioid use disorder, that the bigger problem is being aware of the contaminated drug supply and being able to do something about it.
Thank you, Dr. Lu. So doctors, I have heard about a treatment for overdoses. It's called naloxone. Can you tell us what this is and who can administer it in an emergency situation and how we can do that safely during COVID-19?
I'm so glad you asked about naloxone, because this is what I think of as the low-hanging fruit that everybody has access to. So naloxone specifically, it's a medication that's used in emergency purposes to reverse opioid overdose or the effects of opioids. So in New York State, it's been completely legal since 2006 for anybody who doesn't even have medical training to be able to learn about naloxone, access it, and carry it around in case of an emergency. So in New York City, these naloxone medications can be accessed in different ways. And one way is through pharmacies as well as medical programs and community-based services that are signed up to provide free naloxone training and kits. So for example, at Montefiore, we operate this integrated overdose prevention program in which we actually give patients free take-home kits as well as provide them the necessary training if they come into our hospital system, if they receive primary care. And actually, we also have an arm of our services that interact with community-based organizations, as well as just any community member who's interested in learning about naloxone. So like I said, it's legal and it's free, and it really helps save lives. And I'm happy to connect anybody interested here with resources at Montefiore if they're interested.
Thank you, Dr. Lu. When we talk about steering away from the stereotypes and the stigma that come associated with opioid use, how can we all engage in a conversation to have a little more empathy for someone who perhaps is addicted to opioids?
Yeah, so that's really such a great question. I think historically opioid use and any type of drug use has always been thought of as an individual's personal or problem or something related to their morals. And really what we know about the disease of opioid use disorder is that it's a chronic illness, just like so many other diseases that we see in our society. And so I think the first thing to do is recognize that there's a medical and scientific basis behind the opioid use disorder that's completely treatable. My colleague had mentioned about 2 of the key medications that's been found in decades of scientific research to be highly effective. And we certainly see this in our patients' lives when they come in sort of one day still really struggling with drug use, and then fast forward a few weeks to months are doing so much better with stability in that in the chemistry that's involved in this chronic disease. And I think one of the things that's a key message is for us to really start to think about the words that we use when we're talking about opioid use disorder. I think when we really think about empathy for the other person who is suffering from this chronic disease, really starting to refer to this as a use disorder, as a person who's suffering from it, and refrain from using some of the very stigmatizing language that we're so much more used to hearing. That's when we really begin to transform our attitudes toward this treatable condition that forms a part of our national epidemic.
Very helpful advice. Thank you, Dr. Lu. Before you go, Dr. Torres-Lockhart, can you help us just with any access to resources, a number that people can call for help, treatment, services, all that good stuff?
Yeah, great question. So as an addiction provider at Montefiore, we've really made it our priority to make sure that we sort of literally and figuratively keep our doors open during the pandemic for our patients to really ensure that they continue to have access to these life-saving medications that we've talked about, both buprenorphine and methadone. So at our 6 different primary care sites and our 5 different methadone treatment programs, we've been offering additional flexibility to patients. So we've been incorporating telemedicine into both of our practices to really allow patients to stay home when able and decrease their exposures to COVID, and really allow them to continue their treatments and continue their supports in that way. And so in doing so, we've really been able to continue to see our existing patients and care for them, but also really acquire new patients who have been interested in pursuing treatment during the pandemic. And so, like I said, you can email or call our buprenorphine treatment network. The email is bup@montefiore.org, and then we'd be happy to provide the telephone number as well. And our 5 different opioid treatment programs, also known as methadone clinics as well. Patients can call directly and set up for new patient appointments within the next few days as well. And aside from just medication treatment, so regardless of if someone wants medication or not, if they're using opioids, we also provide sort of harm reduction services for all of our patients as well. So we know that drug use sort of exists on a spectrum from totally abstinent to having a full addiction and the negative consequences with that. And anything in between can be associated with harms. And so we really make it a priority to dispense those naloxone kits that Dr. Lu had talked about to help prevent opioid overdoses. And we also encourage our patients to test their own drug supplies for fentanyl as well to really reduce the risk of overdose. And we also closely refer to our local harm reduction agencies to ensure our patients have access to sterile supplies to use drugs to really reduce the risk of any sort of infections, HIV, hepatitis C, etc.
Thank you, Dr. Torres-Lockhart and Dr. Tiffany Lu, for helping shine a light on National Addiction Treatment Week, which takes place between October 19th to the 25th. We'll be right back.